Describe the primary strengths. I did that one.
I think that's where you left off, yeah.
Yeah. Describe the primary strengths of the MDFT training and implementation.
The primary strengths of implementation of MDFT is they focus on high quality training of the therapists. Therapists go through a rigorous training program. They need to meet standards. There's testing. But I think the major strength is there's all this support to the therapist. So the therapist doesn't feel they're alone. And the same with the supervisor. The other strength is that they take a very developmental approach to the therapist, seeing where they're at and bringing them along on this model over a period of time so they become proficient in doing the model. So they get tremendous amount of high quality supervision, and that really is the guts of training with the MDFT model. It's key for the supervisor to know the model themselves. They're required to take cases themselves before they can supervise somebody. So it's a very developmental approach, and when the therapist is done, they're very competent therapists by the time they get a certification in MDFT. So that's a major strength of that. And then some of those therapists move on, and actually the state hires them. They become juvenile probation officers or do whatever. But they bring that skill set now wherever they go.
What do you think your agency organization's role is in addressing adolescent behavioral problems, drug and alcohol abuse?
Well, when I worked at DCF, we were responsible for all behavioral health for children under the age of 18 as our state mandate. We had state partners with the single state agencies, Department of Mental Health and Addiction Services. We had a partnership with Medicaid so that we could maximize our state and federal revenues. And we also had a policy council of various agencies because substance abuse and behavioral health crosses so many issues: juvenile justice, education, and various systems. So we've had various collaboratives and try to get all the funding to work into what's called evidence-based models. And the policy council was pushing both on the mental health and the substance abuse field, really pushed how can we get these models in the service system.
That's it.
Yeah,